lot of people think that health is shaped solely by healthcare. But what we're finding is that social factors like education have a larger impact on health.
Research shows that only about 10% of our health outcomes are determined by healthcare. Our Education and Health Initiative is trying to raise awareness about the importance of education to health and the way that they are connected.
Education impacts health with different layers, right? There's education about personal behavioral choices, and that people who have more education tend to make healthier choices. But then there's the sort of the social determinant piece of this, which is when you have an education and when you have access to a career and to income, it sets you on a path where everything about the decisions you make day in, day out are the healthier choices.
Education in my community goes a long way. Being educated now means getting better employment, teaching our kids to be successful, and just making a difference just in everyday life.
And those who have higher levels of education have greater exposure to both people, resources, and information that have a focus on healthy lifestyles, which include not only eating habits, but also level of physical activity and awareness.
Being able to advocate and ask for what you want helps to facilitate for a healthier lifestyle. So if it's needing your community to have green spaces, have a park, a playground, it's important to know that you can advocate for yourself and for others.
Self-determination can open a lot of doors for a lot of people. It's best to pay it forward and become a mentor to someone else and help them out and show them that being a self-motivator, anything is possible, anything is achievable. Our kids need to see us all become self-motivators.
In any neighborhood, committed parents and a nurturing home environment are very important to a child's education. But neighborhood conditions do matter.
Well, I've lived here for about 8 or 9 years now, and it is hard for kids to think about their future because there's so much crime and violence going on in the neighborhood.
Things just like not eating or having someone to make you feel safe, it would kind of be impossible for you to get to school and feel a sense of security or safety, to even be able to let your guards down to be able to learn.
If you have a neighborhood that's not motivating and stimulating, then your motivation itself will lack. So if the best thing that you see in your neighborhood is a drug dealer, then that becomes your goal. If the best thing you see in your neighborhood is working a 9 to 5, then that becomes your goal. But if you see the doctors and the lawyers, if you see the teachers and the professors, then that becomes your goal.
Poor neighborhoods oftentimes have poor schools, and these poor schools oftentimes lead to poor educational outcomes. And these poor educational outcomes oftentimes lead to poor jobs. And these poor jobs push you right back in these poor neighborhoods.
Part of what we're trying to do with this initiative is to connect the dots, is to help people in the healthcare field understand the importance of education as a potential strategy for preventing disease and lowering healthcare costs, and helping the many people who are working in the area of education reform to recognize that improved health outcomes for our children and later adults are among the benefits that come from a better education. If we really want to save lives in this country and prevent disease and reduce healthcare costs, we have to do something about education.